Andy Young from the Center for Hip and Knee Replacement in Santa Monica, and we wanted to go over the main reasons why we use robotics in total knee replacement. Again, I'll start by saying that conventional knee replacement using traditional instruments works very well. We did it for years. We did thousands of knees that way. But I'd like to go over how we use technology and why I believe robotics now surpasses conventional knee replacement. Okay, reason number one. But mind you, these reasons are in no particular order. These reasons are based on the actual sequence of how we do a robotic assisted knee. So number one is anatomic modeling. And this allows us to make three-dimensional models of the knee in three planes. We can look at it from the front, we look at it axially, and we look at it from the side. And so we get a clear indication of sizing and positioning. But in addition to that, we can also look at the entire limb alignment. So we are looking at the knee not only in relation to the femur and tibia, but the knee in relation to the femoral head and the ankle for overall limb alignment. And so this preoperative CT scanning is invaluable in terms of preoperative preparation. The other very important thing that we can do is something called micro adjustments. So as we plan for surgery, we can get a view of the knee in all three planes, from the front coronal, along the length of the bone axial, and from the side sagittal. And from this, we can precisely plan the amount of resection that we want to the millimeter, as well as the degree of angle and rotation and flexion that we want to place into the components. From this optimization, then we can then evaluate our deformity and make very small changes up to a degree so that it balances exactly in a patient's anatomy. The third major benefit, in addition to the prior benefit of bone balancing, is that we could do calibrated ligament balancing. So in this patient, we can see, if we look at this number 16, this is 20, we have an asymmetry in our flexion gap. And what we're looking for is a rectangle rather than this trapezoid. We have a 4 millimeter asymmetry between the millimeter, between the inner side and the outer side. And so what we'll do is, using our trackers and under image guidance, we'll selectively release the internal cruciate ligament until it's completely balanced, and now we have a symmetric rectangular flexion gap. So prior to this, everything was by feel. Now we have a quantitative method to know exactly when we are balanced, both by millimeter and by visualization. The fourth major advantage actually comes during the knee replacement itself, and this is the one that I think is the most important. In order to safely do a knee, we have to understand where the danger structures are. So this is looking down the length of the tibia. This is the tibial plateau, and we'll have to remove this surface in order to put our tibial component. Now we come in through the front, but behind this surface is the neurovascular bundle. This is where all the arteries, vessels, and nerves are behind the knee. Now in traditional knee replacement, we can't really see past this area. And so we'll have to dissect all the way around the knee and put retractors to make sure that this end of our tool doesn't go past this. The benefit of robotic knee replacement is that we have a CT scan that completely defines this border. And then prior to surgery, we can place a very clear border around the knee, beyond which this tool does not cut. This is one of the most difficult cuts to make in a knee replacement. This is the posterior condyle. So in this area, the nerves and vessels are right behind. This is one of the hardest cuts to make because it's blind, and that you have to do it by feel and by audio cues. But with the CT scan, I can put a very clear perimeter around it so that I can safely cut, knowing that the tool will never go past this boundary. And reason number 5 is verification, or what we call confirmatory analysis. And so we can start out with our deformity. We can see there's a significant asymmetry, lots of varus. The tibia is translated or subluxed in relation to the femur. We'll go then through bone balancing, soft tissue balancing, And at the end, we can get a computer readout. Now we can see we restored symmetry and the bones are lined up, and we've achieved mechanically at the time of surgery exactly what we had hoped to achieve, so there are no unpleasant surprises afterwards. So robotics has made total knee replacement much safer, more predictable, and verifiable. Now, traditional knee replacement still works very well, but robotics and CT scans and artificial intelligence have made the entire procedure easier for the patient, for the surgeon. Again, number one, reasons are planning with the 3D modeling. Number two, fine-tuning using bone and soft tissue balancing. Number three, we have a calibrated ligament balancing. Number four, we can actually create boundaries around the circumference of the bone. And number five, we can verify what we had hoped to achieve. Thank you very much.